Hey everyone, it's Nancy, the nurse practitioner here with a video for you today. Hope all is doing well. I'm meeting here with Mark Brownstein. He is from a company called Enroll Medicare.com, which is actually his company. He's the director of it, and that's his website, enrollmedicare.com. And we are here today specifically to talk about the 64-year-old who's going to be hitting 65 and needs to decide what are they going to do about Medicare plans. That's an daunting thing to me because I'm almost there and I'm nervous about it, but you have to talk about these things because they're really important. You don't want to miss the boat and lose the deadlines. So everyone at 64 should be listening and watching this. We're going to talk today about are you 64 and should you be looking at your Medicare plan? And we're going to be talking about when and how you enroll in Part A and B. And does Medicare work with your employer health insurance? These are just some objectives. We want to make sure you know why you're on the screen with us so we can share this information with you. Why is the out-of-pocket maximum so important? Why reviewing your plans annually is to your benefit? And the Medigap versus Medicare Advantage plan. So I want to introduce you to Mark Brownstein, lovely man I've met through a group in Rockland County, New York. We're all working with the older population and many of us who are caregivers and taking care of ourselves and others, and we need to know what to do for ourselves as well. He has a grassroots program here where he started Enroll Medicare about 8 years ago, Mark? Is that about right?
That's correct.
He saw the need and the passion and the driven mission of helping the people hitting 65 who are lacking the information about what to do when they hit that age and about Medicare. And then he found that in general, the quality and independent services for seniors as they reach this age was far and few between, and felt the need to develop his own program to help get the word out. So he's a certified senior advisor, and he's got many credentials. He's insured, licensed and certified, and is in over 8 major insurance companies, right? Is that right, Mark?
Correct.
So he also has this great website, so I will pass it on to you guys. It's on my Facebook page. He's got videos, he's got newsletters, lots of great information for all of you across the country about Medicare. So without further ado, let me introduce Mark Brownstein to you. Hi, Mark. Thanks for joining us.
Hello there. Nice to be here. So grateful for the opportunity to speak to you today and to speak to the people who are connected to you.
Ditto. So let's first start on what is somebody like me almost hitting 64, what are we supposed to do? Or talk to us.
So turning 64, as the old Beatles song says, when I turn 64, will you love me, will you feed me? Turning 64 is a demarcation of really another phase of one's life. And for the purposes of this conversation, it's really about healthcare coverage. Certainly, people confuse Social Security and Medicare often in the same conversation. But when you turn 64, people are beginning to talk about it. Your friends are beginning to talk about it. And it becomes a conversation about what do I do? What will I do? What's the timing of it? Because people get a tremendous amount of information in the mail. Again, they speak to their friends and their relatives, but they also hear a lot of ads on TV during a particular time of the year, which is actually coming up soon. But for people who are turning 65 within the next year, it's really important for them to look at the issues around their current employment and their current coverage. So for many people, their group coverage is excellent, and they will keep it if they continue to work past 65. There are other situations where post 65, people look at Medicare as an option because they can save money. So the way the rules work is if you are self-employed, unemployed, or working for a company of under 20 employees, you must get Medicare. So my comment is to have people call me. My services are free. Call me before you're getting ready to retire. Call me before you're turning 65 so you know the rules. So again, 3 months before you turn 65 is when you can apply for it. But prior to that, people want to understand what they need to do and prepare. So very often I'm looking at people's group plans, I'm looking at people's health, I'm looking at their budget, and I'm looking at the timing of Part A and Part B. So that's a beginning to some of the questions you just asked, but it's always important to work with someone who understands this business so that you're not misdirected for the future issues that could come up.
You're golden, Mark. I could see that right now. So can you tell us what Part A covers and what Part B covers for
Certainly. So,
Medicare?
yep, thank you for the question. Part A is hospitalization. And so for people who are turning 65, many people get Part A because it's free and it's almost a rite of passage. People want to have their Medicare card, they have Part A, it's hospitalization only. And as long as the individual or the spouse has worked for 10 years, 40 quarters, paying into Medicare, there is no cost for Part A. And so having Part A supplements any group coverage that you may have for hospitalization only. Again, 98% of all the people I work with pay nothing for Part A. But Part B does have a premium attached to it. And
Mhm.
so the timing of Part B is important. And probably all of the conversations I have with people prior to 65 is understanding Part B. Part B is all of the doctors, x-ray, diagnostic lab, all of the services that are not hospitalization, and some durable medical type work is also under Part B. But again, A and B combined is 80%.
Mhm.
So
That was
A
my
and
next
B,
question.
yep, A and B is the starting point for Medicare.
So if you only have 80%, you need to think about another plan, like a Cigna or an Aetna or something for the other 20%, right?
Uh, yes,
Another
so
shop around after that is right.
absolutely. So the critical component is when one has A and B, and again, if one has group coverage, that is one of the choices that people have is to stay with their group coverage. But every day I look at people's group plans in retirement to see if it's cost effective for themselves, their spouse, or their child to stay on this group plan. Again, group plans are not cheap.
No.
Obamacare, the Affordable Care Act, is not cheap. For
Mhm.
some people, Medicare is a bargain. And the reason is because Medicare comes in different sizes and shapes. The truth is that there are two completely different directions for the supplemental side of Medicare.
Okay.
There's what's called Part C and D,
Yeah.
and then there's Med Supplement.
I was going to ask you about that. So please, can you just, I know this is getting to be like a alphabet soup thing,
It
but
is.
can we just go over C and D for a second?
Sure. So again, as a supplement to A and B, which is 80% coverage,
Mm-hmm.
C and D is really the most popular plans in America. They're called
Okay.
Med plans, but there are 4,000 counties in this country. Each of them have their own Med plan or Part C. Part C, again, is a portion of the remaining 20%. Similar to the plans that all of you might be on now with group coverage, you pay a little bit for copays for your primary care, your specialist, your emergency room, maybe some hospitalization, maybe some x-ray. These are exactly the way these Med Advantage plans. 90% of the country has a zero, I repeat, no cost plan in your county, meaning that you wouldn't pay a premium, but you would pay for the services as you go. So if you're healthy, a Med Advantage plan works wonderfully well because it also includes Part D, which is the prescription drug plan. So
Mm-hmm.
the cost of Part B at the minimum is $144.60. A is free. A and B together, $144.60
A month
a month. C and D could be zero.
per
So it is
person, by the way, right?
per person. Thank you.
Thank you.
But for $144.60, if you are in reasonably good health, you can have as good a plan, if not better, than the plan you have now with your group coverage. and you pay as you go, similar to what you have now. So that is A, B, C, and D.
So I have a question for you.
Sure.
Of course, people do work till 65, and if they keep their insurance, you're good to go, and you don't have to take Medicare yet. But like, what about the people with the high deductible? I mean, I'm just getting off tangent, but like, we have an $8,000 deductible,
Right,
and I ended up falling and landing up in the emergency room, getting
right.
10 stitches in my leg, and I had to cough up $1,800 because I hadn't met my deductible. You're healthy, but then something happens to you, and then you get banged by this stuff.
Well, that is absolutely true. So similar to the group plans that have these high deductibles, these Part C and D plans have high deductible as well. So when you're healthy, then these plans work well. If something occurs, then for that year, it could be expensive. In New York, in Connecticut, in Massachusetts, and Maine, those are 4 states where you can switch from a Part C and D plan to a more expensive, no network model of Medicare with no health questions asked. Part
Wow.
of part of the question is how conservative are you? How conservative is the client in terms of not having a crystal ball?
Hmm.
Some people say I want the best coverage possible. And some people will say, I want to save some money.
Hmm.
And if I get a $2,000, $3,000 bill, that will be the last year I'm on that plan. Or maybe that's an anomaly. And that year, I know I saved a lot of money, but the next year I'm going to be fine. So the decision is for me, every year it's about discussing how
Hmm.
has health changed? How has budget changed? So the reason I bring all this up is because the other side of the conversation is these Medigap plans, which depending on the state in which you live in, it could be between 150 and 300 a month.
Hmm.
For that, you pay no copays, no deductibles, no coinsurance, no hospital, no surgery, no x-ray, no diagnostic. So you have the 144.60 for Part B plus a more expensive plan called Medigap. Then you have the best coverage money can buy in the country. So you're either dealing with an HMO for zero premium,
Hmm.
or you're dealing with a more expensive model where you're covered without a network. And those are the decisions and discussions that everyone should have with full disclosure to be able to understand the options.
Well, as a clinician myself, I know that if you're not in network and you're the best person they want to see, they either have to go to you and pay out of pocket, or find someone in network, and it may not be the person they want to see. It's almost like you don't get to choose because over money, sometimes, the doctor or the
That's
clinician you
right.
want to see.
That's right. So when someone goes forward with a Part C and D plan, it is critical for me and for them to evaluate the doctors that they have. Now they don't know what doctors they may see, but the
Right.
doctors that they have, I would check 7, 8 carriers, see which doctors are in the network.
Hmm.
On the other hand, if they go the higher premium route, the question for the practitioner or the facility is very simple. Do you take Medicare? So the Medigap plan is still original Medicare.
Hmm.
On the Part C plan, you're on a very, very large group plan. And
Hmm.
so the difference is really quite significant. And I do my best to explain this, whether it be in 10 minutes or in longer, the webinars that I do, to try
Hmm.
and have people truly understand not only the enrollment that we started with, but also the options for group coverage, Med Advantage, and Medigap.
So where are these webinars, Mark, while we're at it? Because this is a lot of information. It's
It is.
wonderful. Where's your webinars? On that site we're going to give out to everyone?
That's right.
Okay, good.
Emeraldmedicare.com. I
Yay.
have different tabs for different types of people. I support veterans proudly. I support people in an
Wonderful.
HR capacity, people turning 65, financial planners and CPAs. So yes, anyone can go on and enroll in any of our seminars, and in an hour you would see and hear a lot more about what Medicare is about.
This is so wonderful.
And
Yes.
on their current group plans, when I ask people if they know about their plans and even how much they're paying for it, people often send to me their benefit details so that I can explain to them what they have now. If
Mhm.
they're healthy, they haven't really utilized it. If they're not healthy, then they're utilizing it in a way that they've seen some of these out of pocket issues come up. Um, Again, there are a few states in the country where the
Yeah.
rules are different.
That's
Um,
pretty neat. So what if you move to like Delaware or Maryland? You're off the hook, you're not in that little game plan. This is only Northeast, right? Those four
well,
states.
it happens to be in the Northeast, and but the pricing for these premium plans are less expensive in
Hmm.
these other states because they don't have what's called adverse selection. In New York, Connecticut, et cetera, it's more expensive for these plans because they are taking in unhealthy people. In
Hmm.
these other states, if someone is applying for it, they are able to get it at a lower price because they're qualified. Now, you can get coverage in these other states, but they can ask health questions and they can go back 2 years and forward 2 years. And so all these things are about transparency. When you're working with a independent person who is looking out for your best interests,
Hmm.
as opposed to a carrier who is trying to sell you on their particular plan. That's what I pride myself in. That's what I do. And I'm always looking out for the best interests of the client, both financially, health wise. And of course, the one thing I always want to bring up is the prescription drug side. It is probably the largest conversation I have with most people because that's their biggest concern because there's no out-of-pocket maximum for prescription medications.
So Mark, this is incredible. You're definitely not going to be on my calendar next year. Call you. So there's two slides that we wanted to screen share, but we're going to better put them on my facebook.com, everyone, slash caregiver success. Maybe you could tell us quick what the titles of those two slides are so they know what they're looking for.
Sure. One is called enrollment periods. The enrollment
Okay, good.
periods are when do you need to sign up? What's your annual ability to change? What are some of the special enrollments if you move, right? If you are on some subsidy plan, if you're on Medicaid, you have special enrollments. But people get confused with dates. And so the first slide is about enrollment dates. The second slide is called four choices. I keep it simple when it comes to Medicare. You have four choices. You can stay on your group plan. You can go to original Medicare. You can go on Part C and D. You can go on Medigap. Those are your four choices, and that's what the slide speaks of.
So you're making it better for us to be, it's simple, but you're also educating us so we're not scared to put our head in the sand and say, I don't want to deal with this, it's too scary.
Yes, that's true, Nancy, and I am helping people now at the end of the month for the beginning of next month, which is 2 business days away.
Oh my
So
gosh.
those things happen, and myself and my team really work hard to take care of all of our clients. We're proud of what we do. We work hard for our clients.
And how are you paid actually, Mark? Can I just ask that just because people like transparency about this kind of thing?
That's a great question. Thank you so much for asking. As I get paid by the insurance company, if I help you with A and B, that is really my gift to you in helping you enroll. I've helped people with A and B, and 3 years later, they've called me. But I get paid if I sell you either. I help guide you towards a Part C and D plan or a Medigap plan. Those I get paid by the insurance company, and I help, probably 300-400 a year. And,
It's amazing.
the prescription drug plan is another piece, a small piece, but as I said earlier, a critical piece. So I get paid by the insurance company, but I'm certainly proud to say I'm independent. So I'm not captive. I'm not devoted to any carrier at
And
all,
not
um,
biased.
and not biased at all. And
That's
again,
key.
my services are free. So many people who do what I do around the country, so
Hmm.
many of them are doing this part-time,
Hmm.
or they have another business model. Let's call it financial planning. Let's call it long-term care. Let's call it property and casualty, health
Got it.
brokerage. this is all I do is Medicare. So I'm devoted to this 12 months a year. Also, a lot of people only work during the time frame of what's called open enrollment, which is October 15th through December 7th. So
Thank you.
maybe they're working from September to January.
Mhm.
That's a nice part-time gig. But to me, this is a full-time gig because people turn 65 all year long and people retire all year long. And so that's my business model. And there are certainly many, many agents out there who do what I do, but I believe few do it the way I do it.
It sounds great. And so what's the best way to reach you, Mark?
Um, the best way to reach me is really through our website or a phone call. Again, emeraldmedicare.com. One of the phone numbers is 845
Mhm.
358 1220. Please call, please reach out, listen to my doodle video, my boomer video, or just come to a webinar and listen and learn.
Wow, this was so informative. I'm so glad I met you along the way here, Mark. So I'm going to be providing everyone with this email, emeraldmedicare.com. The phone number again is 845-358-1220 to meet and reach Mark Brownstein from Emerald Medicare, he's the director. And also we'll be putting those slides up there that we mentioned before. So you'll have a lot of great information. He covers people all over the country, so you don't have to live in the Northeast where we are. Feel free to reach out to Mark. He's great and he knows what he's talking about. So Mark, thank you so much for being part of this. So we
Thank
can
you,
help
Nancy.
everybody out there. We all need to help each other.
Yes.
And stay well, everyone, till the next video from Nancy, the nurse practitioner. Take care now.